Hello, today we are going to discuss about the joints formed between the sternum and its other parts. Okay, here the joint between the manubrium and the sternum is called manubriosternal joints, and it is the secondary cartilaginous joint, means symphysis. And the joint between the clavicle and the manubrium is the saddle type of synovial joint. And the joint between the first rib and the manubrium are synchondrosis, means it will fuse. It is the primary cartilaginous joint. It will fuse with the age. Synchondrosis means, okay. And the joints between the sternibrae are also primary type, means they will ossify in future. Here also it is of primary cartilaginous, means xiphosternal joint is also primary, means it will also get ossified in future. Okay, now how can you remember the secondary and primary cartilaginous joint definition? Okay, this is the main question. Secondary cartilaginous joint means it will present both in child and adult age, means adult phase. In both phases it is present. Primary means only one phase, that is child phase. Only in children it is present, but in adults it will get ossified. So primary cartilaginous joint is only in one phase, that is child, and secondary cartilaginous joint is present in both child and adult phase. So it is called secondary cartilaginous joint. Okay. One more thing I forgotten to say is that the joint between the first rib and the sternum is the only cartilaginous joint, and the joint between the remaining ribs and the sternum are synovial joints, that too of plain type, means plain type of synovial joints, hinge joints I can say, like that. Plain type of synovial joint means gliding joints I can say. Okay, not hinge joints or gliding joints. Now this is the one. And now coming to the joints in the vertebra, or between the body and the pedicel, the joint is primary cartilaginous joint, means it is ossified, it will get ossified. And the joint between the upper smaller part of the rib and the superior demificate of the vertebra are secondary cartilaginous joints. And a joint is present between, it is not secondary cartilaginous joint. I'm saying it is a synovial joint, or that of plain type. And between these lower larger part of the rib and the inferior demificate there is one more joint. And here the transverse process articulate with the scalene tube, with the tubercle of the rib. It is also a synovial joint. And one vertebra articulate with the other vertebra, both superiorly and inferiorly, by secondary cartilaginous joints. Okay, now that's it. And totally we can see that each vertebra have two primary cartilaginous joints and two secondary cartilaginous joints. And what is the number? 1 minute. 8 plain synovial joints. And one more thing is, superior articular surfaces of the vertebra articulate with the inferior articular process of the vertebra above, which is present above. In the same way, inferior articular process of the vertebra articulate with the superior articular process of the vertebra below it. Means if this is one vertebra and this is the inferior articular surface of this vertebra, it will articulate with the superior articular surface of the vertebra present below it. In the same way, the superior articular surface of vertebra articulate with the inferior surface of the vertebra present above to it, like this. Okay. Now we are going to discuss with the joints formed by a rib. The ribs are arched bones, and the joints formed by it are it will articulate with the adjacent vertebrae. The posterior end of the rib articulates with the adjacent vertebrae along with the intervening intervertebral disc. The vertebrae are corresponding one, and the corresponding rib, the corresponding vertebrae, and the vertebrae present above it, and also with the intervening intervertebral disc, and the tubercle, articular part of the tubercle articulated with the transverse process of the corresponding vertebrae, and the anterior end of the rib is continuous with the cartilage. It is a primary cartilaginous joint, means it gets ossified in adults. Okay, and the joint present between the sternum and the cartilage is a plain synovial joint. Okay, and the respiratory movements produced by the movement of the diaphragm are called then it is called abdominal respiration, and the respiration movements produced by the intercostal muscles, then it is called thoracic respiration. These are the important points related to the respiratory movements. Okay.